Did you say monarchy?
Monarchy.
Like butterfly monarch?
Monarchy.
Sorry, 我的耳朵。Hi, I'm Joie, and welcome to the second episode of Poly Talks. In this episode, we are deep diving into the importance of medical consultations when facing symptoms with Polycystic Ovary Syndrome, also known as PCOS. If you're sitting here wondering, what is PCOS? Do I have it? It sounds kind of important. Head on over to the first episode where we discuss the 101 of PCOS, from common symptoms to complications. In this episode, we are very excited to have Dr. Zhongwei to share all about medical consults for individuals with PCOS. Hello, Dr. Zhongwei.
Hi, Joey. Thank you for having me here.
So excited to have you here. Can you please tell us a little bit more about yourself?
Sure. I'm Dr. Huang Zhongwei. I'm a consultant at the Department of Obstetrics and Gynaecology at National University Hospital. So one of my subspecialty is looking after couples with fertility problems. I do IVF cycles. I also look after mothers during their pregnancies. And very importantly, I have a very deep interest in understanding the reproductive biology, fertility, especially in PCOS in women.
That is so cool. I am ultra excited right now. So from our last episode, we introduced Polly. Have you heard of her?
I have heard of Polly.
Polly's everywhere, but I don't know if this is the Polly that you're thinking about. I just realized if Polly opens a clinic, we can call it a polyclinic.
That's a good one.
I know, right? This is Polly. She's very cute and beautiful. And basically, she showcases all the common PCOS symptoms. So if a woman experiences PCOS symptoms, what should she do?
So I don't like to label a young girl with PCOS. So from what I understood and also looking after women for a long time, it's important that we need to know when's the girl's first period in her life. And that's known as menarche. And based on the latest guidelines, it's usually after 8 years from a young girl's first period in her life that we can assess and then make a possible diagnosis of PCOS at a point in time.
Wow. Did you say monarchy?
Menarche.
Like butterfly monarch?
Menarche.
Sorry, 我的耳朵。Got you. That's
Yes.
so cool. So only 8 years after the first period can you
Yes.
consider PCOS?
Yes, absolutely. Because during that period of time in young girls, adolescents, her cycles can still be irregular. The body is undergoing maturation, and there may be times that she's not ovulating as well.
Okay, so say it has been 8 years or even more than that, and they find that they do tick the boxes and have the symptoms. What should they do?
I think absolutely it's time to really seek a formal medical consultation and allow the doctor to run through all the symptoms again with her so that she has a proper assessment before making a diagnosis of PCOS.
On the flip side, I've also heard that PCOS has been dubbed as a silent killer. So you could have the symptoms and it can incorrectly associate with other lifestyles and illnesses. What are some symptoms that are incorrectly associated with other lifestyle factors?
Well, I think one of the most common issues that we may link it to is having acne. Typically, this acne is a problem that recurs and can happen in more than just the face. It could happen in a more florid manner, for example, over the back, and it can get quite severe. And I think there are other things that, a young woman can get confused with irregular cycles because she could be having lots of stress, she's not sleeping well, exams are coming, relationship problems at school or otherwise, and she thinks, oh, there my periods go haywire again. Is it because of that? So all this could actually let her misinterpret her symptoms as like, oh, is it just lifestyle that's causing me having these problems or otherwise?
Definitely. You just took me back to my secondary school days where once I got my pimples, right, I cut bangs. I just immediately cut to cover. And I remember having back knee, and back knee was a thing as well, especially because I was playing sports.
Precisely.
So there's so many different lifestyle factors that could cause you to maybe have some unnecessary panic. But then you would rather be safer than sorry, right?
Absolutely.
So are there any key benefits of receiving an accurate and early PCOS diagnosis?
Yes, I think that is a very prudent way to ensure that your health is kept in check. It's definitely not good to dismiss the symptoms. It's always ideal to just seek a medical consult. Just ensure that, are you falling to any other problems that you're not aware about? And I think that awareness is important from the beginning.
Okay, so let's now move on to what women can expect during consultations. Is there a specific criteria that doctors use to determine whether an individual has PCOS?
Excellent question, Joey. So we actually use the 2003 Rotterdam criteria to sort of diagnose a woman with PCOS. So if a woman have 2 out of the following 3 criteria, then we will most likely diagnose the young woman as having PCOS. So the first is having irregular cycles, as mentioned earlier to you. Second is where if a young woman demonstrates clinical signs of hyperandrogenism, which means that the levels of testosterone levels in her blood, or signs that her blood shows that the testosterone levels, the male hormones, are much higher than is recommended in a woman. And she might also have signs like excessive body hair or hair on the lips or excessive acne. And finally, it's the ultrasound appearance of polycystic ovaries. And now there's a new criteria in place of that based on the latest guidelines. We'll be using this blood marker, which is a marker of ovarian reserve known as anti-Mulderine hormone. We can also use this to sort of help us make a diagnosis of PCOS.
Based on what you're saying, right, maybe a few of these can be self-reported. Like, you can tell if your period has been irregular.
Absolutely.
Also, if you're not tracking your period, please do. It's like the best thing. I think it's so fun. I have a group chat with my friends.
Right.
And like we just send a GIF of anything that can be interpreted as a period.
Oh my gosh.
Yeah.
Oh wow, that's an interesting new way.
Better than the app lah, I find.
Yeah, because every time I ask a woman, when is your first day of a last normal period? And then they were like, hold on. And they will start scrolling and I'll just wait there patiently.
So, as well as body hair, right? Like body hair, you're able to tell. But then when the androgens don't show up in the form of excessive body hair, how would you then test for these invisible symptoms?
Yeah, I think these invisible symptoms will all be checked in the bloods. So we'll draw bloods in the clinic setting to try to assess some of these hormonal levels.
So what about the polycystic ovaries? Because these are considered more invisible, right?
Yes, indeed. So in a typical doctor's consultation, we will first perform a physical examination, which means that we'll assess the woman for areas for acne, not just the face alone, but also assess for body hair distribution. Importantly, we also want to perform abdominal examination to check on the tummy, and if possible, pelvic examination to check if there's any masses that's out of the normal. And that's quite important to make sure that we do complete a physical examination. Then we'll move on to do an ultrasound scan to really look at the appearance of the ovaries to see if they appear polycystic ovaries in appearance. And we also will check the womb lining to see if it's extremely thick because the woman with Polycystic Ovary Syndrome, PCOS, can have irregular cycles and can make the lining very thick.
Wow. That's a lot. And that can be very daunting. And I think the first question that pops in my head is when you said pelvic examination.
Yes.
And as well as ultrasound, right? Are those procedures invasive?
Well, to most women, it will seem really scary at first. But based on the Rotterdam 2003 criteria, to assess the polycystic ovarian appearance most accurately, it should be an ultrasound scan done via the vagina.
Let me just clarify that. So the ultrasound is done not via the belly, but via your vagina, which means...
Internal.
Okay, got you.
Yes.
And would a woman experience discomfort or pain even during this examination?
Right. So I understand that many women will be so scared about having this machine to go into a very private area to perform the examination. But the truth is, actually, most of the time it's painless. If a woman is relaxed and understand what the ultrascan is for, and most of the time they are able to tolerate the vaginal ultrasound scan very well, and it allows us to have a very good visualization of both the ovaries so that we can make an accurate diagnosis.
Okay, I beg your pardon, machine? Like a machine?
Oh no, let me clarify. It's just a very slender ultrasound probe that fits more to the natural curves of the pelvis. So it's actually quite tolerable for most women when they undergo a transvaginal ultrasound scan.
I like how you said slender probe, right? And I'm still like scared.
So it is being manufactured such a way that actually it fits your natural pelvic curve. So it's actually more physiological.
See, that sounds comfortable now. Now I feel like I can trust it.
Yes,
Like,
absolutely.
I love being a woman. Like, that just sounds so comfortable, right? Okay, but a question, maybe a personal question. I don't know about you guys watching, but I'm terrified of pap smears. And I've heard so many stories of it. How would you say a pap smear would compare to this examination?
Well, I would say that a transvaginal ultrasound scan actually is more physiological. I think that's the right word to use as compared to a pap smear. So it's definitely more comfortable than a pap smear.
Okay.
Yeah, and a pap smear, in the same way, is also trying to understand how the pelvis and the body is like. So if a woman knows what the indications are and is relaxed and comfortable with the doctor looking after her, it actually is not such a scary experience after all.
That's true. That's why it's really important to find a doctor you're comfortable with that you can trust.
Yes.
Will everyone be suitable for this intrusive examination?
So for this particular examination, we will only perform it on women who ever had vaginal intercourse.
Oh, okay.
Yeah.
Does this have to do with the breaking of the hymen?
Indeed, for a woman who never had vaginal intercourse before, this will be extremely uncomfortable and stressful to her. Yeah, so ideally we do not perform such procedures on her. So in this case, we offer the second alternative, which is do an ultrasound on the tummy to at least assess the ovaries to make sure they look normal, as well as also correlate, if possible, with a blood marker such as anti-malarial hormone to gauge and assess more accurately for PCOS.
So for me, I learned about PCOS mainly from online as well as through friends. And I've heard sometimes that, they might prefer specialist care over GP care. Maybe the GP doctors are not as thorough. I feel like it could possibly be a misconception. What are your thoughts towards seeking primary healthcare services or specialist care when you're facing PCOS symptoms?
A lot of time, primary care providers, our GPs, are all around us in the polyclinics and the GP clinics itself. And I think if a woman has concerns about her symptoms of PCOS, they should see a primary healthcare provider first, run through the symptoms, get a holistic approach as well to her general health advice and lifestyle, and only if there are any specific concerns that she had that might require specialist opinion, then the primary healthcare provider can then refer over. So from my understanding currently is that any referrals from polyclinic doctors to our public hospital specialists will be at a subsidized rate for Singapore citizens.
That's actually really good to know, because I feel like the financial part of it could also be a deterrent for people just to even get diagnosed. So, good to know. Okay, Dr. Zhongwei, thanks so much for sharing. Before we wrap this episode up, we crowdsourced some questions regarding medical consultations for PCOS on Instagram. Can you spare a few moments to answer them?
Sure.
All right. Actually, if you say no, I still want to ask you because I'm very curious too. So the first question is, how impactful are lifestyle changes to the management of PCOS?
I can't emphasize the importance of what a lifestyle modification can impact on the woman's general health, but in particular PCOS. So in this case, for any woman who is above a normal body mass index, I would say that, just bringing her weight down by 5 to 10% is actually good enough for her menstrual cycles to be regular again. And what we usually understand is that regular menstrual cycles usually indicate that she undergoes ovulation, which is a positive sign that things are going back to clockwork again, and I think that's important for a woman's health. Now, to bring down this weight loss is not about not eating or complete no food, but rather is to have a healthy diet, is to do enough physical activity such that you have a healthy and sustainable lifestyle that will help you bring about this positive change.
Thank you so much for answering all those questions. And for those of you who have more questions, please head on over to our Instagram and you can feel free to ask away. We are at mission.pcosible, mission mission.PCOSSIBLE. Thank you so much, Dr. Zhongwei, for your time. Before you go, do you have any last words for women who are facing symptoms of PCOS?
Yes, thank you for having me on this, and I'm very glad to be here to share some of my advice to women. And I think to young women out there, after having your first period, please do look out for the regularity of your menstrual cycles. And if after 8 years of having periods and you realize that your period still remains irregular or is still erratic, then please seek medical consult early so that we do not miss something in your life, and do have a balanced and healthy life all the way as a young woman.
Yeah, let's manifest that. Thanks for that, Dr. Zhongwei, and thank you for listening. For our next and final episode, we have 2 women to share with us about their lived experiences with PCOS, find out about their journey after early consultation, and we'll see you then. Bye!